if you can catch most of these cancers early, then that's what's important. So I think probably one of the most important, let's say, changes to our medical system that could be initiated would be, frankly, the use of things like MRI, not CT scans, because CT scans are known to cause cancer.
Which is so crazy.
Yeah.
Like, when did we figure that out?
I mean, there was like a big study just published recently that said, here's what happens to people once CT scans were implemented, and you see this sudden spike in the... I mean, again, it's this cost-benefit ratio. If you didn't have it, certain people wouldn't know that they have a giant tumor in there.
Right.
I mean, so for instance, I had, when I had kidney cancer, I was actually at a restaurant with friends doing a business deal, actually. And I went to the bathroom and it was blood. And I said, okay, we got to go to the emergency room like now. And then they did a CT scan, and they see this, the brachial tree around my kidney was just a big diffuse mess, and they came in and said, you've got cancer.
Did you have to have your kidney removed?
Yeah. It was, but it's okay. I'm alive.
It's nice to have two of them.
Yes, exactly. I'm alive, but it is this early detection is important. I mean, I was lucky that it hadn't metastasized yet. It was called clear cell renal cell carcinoma. But so surveying the body, and these companies that are out there right now which do it, I think are really important, because even if you are young and you have no suspicion you're going to have cancer, having that baseline against which you can compare later changes is important. Because I could do, for instance, a CT scan or an MRI of you, and I'd find lots of little anomalies. And they're generally in the field called phantomas. They're these objects that may be worrisome, but we won't know that they're worrisome, and certainly not going to do a biopsy of them and poke a needle into your chest to pick out a piece of it. But if I come back 6 months and it's changed, then maybe it's something we need to go after, more seriously. So getting those kinds of regular scans, I think, is probably one of the more important things that could be done, but not by a CT scan.